got my jab now at 10:50, exactly an hour after it was scheduled. There are 28 booths or tables to give the JAG, only 8 are being used. In fairness, the staff were very, very friendly and nice. The person who gave me my flu and booster jab was perfectly polite, but overall my wait was 1 hour 25 minutes. Yes, I did come early, but the wait would have been the same had I arrived on time, and had I arrived at 9:50, I'd have been looking at a time probably in the region of 20 past 11 before I was vaccinated.
Well, that was Greg. In response, Glasgow and Greater Clyde Health Board said, "We apologise to any patient who's waiting longer than expected for the vaccine. The announcement of the new variant significantly increased the numbers of people coming forward for their boosters, and the number of those eligible for vaccines has also increased substantially. In light of this, patients may need to queue longer than expected." There's a bit else, but you get the drift there. They're expecting people to have to queue for a little bit longer. Let's talk to Scotland's National Clinical Director, Professor Jason Leitch. Hello, Jason.
Afternoon, John.
You've had a busy week or two. I've heard you on many of our outputs. So but just this booster queuing thing, I guess the honest thing to say is we probably do have to expect to wait a little bit longer than we thought we would when we turn up for a booster.
That's absolutely right. John, I don't often say this. I think your coverage is usually very, very balanced. I'm slightly disappointed with the balance of that last 2 or 3 minutes because, yes, the wait is really important. But let's start that conversation with that producer is now fully protected as far as humanly possible against COVID-19. That doesn't happen in most countries at all. Never mind waiting for an hour and 20 minutes to get it here. Now, people are now yelling at the radio saying, I had to wait for this and I had to wait for that. And I completely understand that, particularly those who are vulnerable, particularly those who maybe can't stand in a queue, can't wait in the cold. I absolutely agree that we should get them in as fast as we possibly can. But you know what? I'm going for my booster on Friday. If I need to wait an hour and 20 minutes, I'm very happy to do so.
Chris Whitty, Chief Medical Officer for England, saying the record for cases is going to be broken a lot. I think Boris Johnson said 780,000 cases. He was just out by a factor of 10.